871 in medic 6. You're seeing a 74-year-old male, shortness of breath.
Possible roof fire. Did you advise the code? That's a cover. Did you copy code blue in the backyard?
Successful outcomes for cardiac arrest patients rely upon a well-planned and well-rehearsed approach to resuscitation.
We need 300 down the tube though, right guys? We're doubling it? I figured he weighs at least 100 keys, 220, looks good to me.
As it's been said many times, it's critical to have a well-orchestrated response team managing a resuscitation. The only thing worse than no emergency plan is to have 2, 3, or 4 emergency plans and having people freelancing and everyone doing a different thing.
We got 200, clear? Okay, let's get a line, get some lidocaine on this guy.
Resuscitation training and education cannot be thought of as a single skill, but rather the synergy of many practitioners working together to achieve an optimal outcome. Each resuscitation effort requires coordinating a team of responders to execute high-performance CPR, airway management, ECG monitoring and defibrillation, and vascular access and drug administration. To maintain the highest degree of proficiency, EMS responders must continually practice code management skills. Practice on a regular basis keeps skills sharp and promotes more successful resuscitation attempts. As an EMS provider, you must have a clear understanding of the responsibilities assigned to each role of team-based code management. This program provides a review of the skills and tools used in resuscitation efforts. By practicing the dynamics of code management with a team-based approach, you can help to improve resuscitation performance and the likelihood of better patient outcomes. During a cardiac arrest, the two most important priorities are CPR and defibrillation if a shockable rhythm is present.
The primary goals and considerations when dealing with a cardiac arrest is to start CPR as soon as possible. For every minute that a person is in cardiac arrest, their chances of survival decrease by about 10%. To strengthen the chain of survival, really it's early detection of a cardiac event, early CPR, early defibrillation, and early advanced care, but really it's really all about speed. The faster we can get there to begin CPR and defibrillate, the better off the patient's outcome is likely to be.
Code management is most effectively executed when a team of rescuers work together in a cohesive manner to provide coordinated and comprehensive patient care. Each member of the resuscitation team is responsible for something specific. Team lead, chest compressions, airway management, cardiac monitor, and IV and medication administration. The team lead is the most critical role on the code management team and is typically the most advanced, high-level responder.
Somebody has to be in charge of the resuscitation team to assure that there's really good orchestration between basic and advanced life support, and that rescuers are changed out frequently, and that really nobody is performing cardiac compressions for longer than a couple of minutes at a time. To do that means that somebody has to really be organizing the team and making sure the team performs, just like a good coach would be on an athletic field.
The team lead is responsible for managing patient assessment, overseeing the end-to-end resuscitation efforts, keeping each responder focused on specific tasks, and ensuring that team members perform their tasks safely and correctly. The team lead must ensure that the patient is on a hard surface to optimize compression efficiency and that the team has plenty of room to work. During the resuscitation effort, the team lead oversees each task and often serves in more than one role to simultaneously manage the scene and fulfill a task-based role. The team lead begins managing the code by asking team members to obtain baseline physical information, providing an event history to responders needing this information, evaluating all data available, and making patient care decisions based on this information.
You know, a great vantage point for the team leader is to take the cardiac monitor, again when advanced intervention arrives, take the cardiac monitor and put the cardiac monitor down towards the patient's feet and be right next to the person who is going to be administering the drugs, perhaps on the other leg through the IO. From the position at the patient's feet, it's then really easy to watch how chest compressions are being done and also assure that the person who's on the airway is controlling the airway properly and not overventilating or underventilating a patient.
During resuscitation, the team lead assumes responsibility for evaluating the adequacy of chest compressions, assessing the adequacy of ventilations, ensuring defibrillation is performed safely and correctly, directing the insertion of an IV, confirming proper positioning of an advanced airway, and ensuring correct drug dose and administration. The team member in charge of chest compressions takes responsibility for providing high-quality chest compressions. This involves giving compressions of an adequate rate, force, and depth in the correct location.
High-quality chest compressions really means providing an optimal rate and force of chest compressions and really not having any interruptions of chest compressions at all. It means compressing the chest at a rate of about 100 times a minute. It means complete recoil of the chest to make sure that we don't leave any pressure on the chest, which inhibits blood flow back to the heart. And it's also adequate compression depth.
The team lead helps to ensure that this team member is administering high-quality compressions and ventilations with minimal interruptions and facilitating the transition when team members must shift roles.
The person who is first on the chest needs to be relieved within about 2 minutes to assure that they're not doing compressions for too long. When help arrives, then one of the two rescuers that first arrived on the scene needs to drop back and assume control of the overall situation to assure that proper chest compressions are being done, compression rate and depth are appropriate and accurate, in that there's proper recoil to the chest.
The airway management team member is in charge of performing appropriate head tilt, chin lift, and jaw thrust maneuvers, sizing and inserting an oral airway, applying oxygen delivery devices, and properly securing and confirming placement of an advanced airway. If no advanced airway is in place, 2 breaths are delivered after 30 compressions, with no more than 10 seconds interruption of compressions. If an advanced airway is in place, ventilations are delivered at a rate of 1 breath every 6 to 8 seconds, without interruption of compressions. When a patient has pulseless ventricular tachycardia or ventricular fibrillation, defibrillation is indicated. The cardiac monitor team member is responsible for operating an AED or a manual defibrillator.
Copy. Okay, good. Continue CPR.
The IV and medications team member manages emergency medications, intravenous fluids, and related supplies, and performs procedures for vascular access. Without interrupting CPR, this team member is responsible for gaining vascular access using a peripheral IV with a large gauge catheter. If needed, this team member administers drugs using the correct algorithm. By having clearly defined roles and associated expectations, a team of responders can ensure that the patient's many needs are met throughout the resuscitation effort. This team approach also helps minimize interruptions or delays in treatment. Responders who work together as a team can reduce fatigue and distractions that may potentially compromise patient care. Code management depends on the expedient administration of care by a highly skilled team of rescuers working together. This teamwork allows providers to define priorities and take a task-centered approach. A team approach also serves to manage the code as effectively as possible by providing clearly defined responsibilities for each role. This increases efficiency as responders who are working in tandem can reduce delays in treatment. To maintain proficiency, responders must train and plan for on-scene response. This includes practicing the team approach, ensuring each team member is versed in each role, working to continually refine team operations, and setting annual schedules for training and evaluations.
I think the big take-home message is it requires practice, 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 and really, effective resuscitation today really is all about high-performance basic life support with selected advanced life support skills which advantage the circulation. It requires practice, and running a code today and doing high-performance CPR is deceptively complicated. It's a lot more difficult to actually do it than it is to talk about it, which means it's something that you have to practice regularly.